Well, the most common cause of diarrhea tends to be a viral infection such as the rotavirus, the norovirus, and other types of viruses. Now, viruses are self-limiting and they usually do not last for more than 7 to 10 days. So usually when you have a diarrhea, it might be worse for the first 3 to 4 days. You would experience frequent stooling, could be every 30 minutes, every hour, or even every 10 minutes for the first 24 to 48 hours. And you feel like you're basically emptying your bowels out. Your stools can be quite watery. Sometimes they can be quite mucousy as well, especially if you've got inflammation of the bowel. Diarrhea would also be accompanied by, tummy pain, fever, feeling quite lethargic, unwell, especially with food poisoning, which can also be caused by viruses that get into contaminated food. You might now experience vomiting. Some cases, vomiting might happen first before you get the diarrhea, where basically you're vomiting again quite frequently every 30 minutes or only hour with the same symptoms of fever, tummy aches, and just feeling really quite poorly. Now, vomiting shouldn't go on for more than 4 days. If your vomiting is going on for more than 4 days, then this is the time you need to see your doctor because there's obviously a risk of dehydration, risk of kidney failure. But with the diarrhea itself, diarrhea due to viral infection can go on for as long as 7 days. But what you would notice that is with each day, your frequency of stools are getting less. So if on the first day you go about 20 times, by day 4, day 5, I would expect you to start going about 6 or 7 or 8 times, depending on the severity. Now, you are going to be quite dehydrated during this time, so we do advise to take sips of fluids. Do not drink, whole cups of fluids because that might make you to vomit, but take sips of fluids just to keep yourself hydrated. Again, a lot of patients or people would ask, what is the medication that I can take to stop the diarrhea? Now, there's over-the-counter medications such as Imodium, otherwise known as loperamide. However, Imodium is a stopgap. What I mean by this is that Imodium should only be taken absolutely necessary. If you're going 20 or 30 times and you feel you need a break from going to the toilet, yes, do take some Imodium. Or if you're not taking time off work, you have to go to work, you're going on public transport, there's no access to a nearby toilet, or you're going to be in a meeting that's going to last for 2 hours, then Imodium is a drug of choice. And what Imodium does is stops you from having the frequent stools or the diarrhea. However, we do not advise taking Imodium as a way to try and permanently stop the diarrhea, simply because you have to remember that your body is naturally getting rid of the poisons or the toxins within the body by getting rid of the stools, whether it's liquid or watery. So the more it comes out of your body, the better you start to feel in the long term. Now, I mentioned that diarrhea can be caused by a viral infection. Diarrhea can also be caused by bacterial infections such as E. coli, for instance. This is common in foods that have not been cooked properly, maybe such as meat, for instance, or fish, or whatever types of food. You will find E. coli. Even in certain types of vegetables, you can find E. coli as well, but it's more common in meat that has not been cooked or fried properly. So just be aware that with diarrhea due to bacterial infection, you might get more severe symptoms than you would with a viral infection. And some people might actually notice blood in the stools. There's different types. You've got your Shigella, you've got Salmonella, you've got Campylobacter, which is quite common with eating maybe raw or poorly cooked chicken, for instance. And it's quite bloody diarrhea, fever as well. In a lot of cases, you run off to A&E because you're quite alarmed by the blood, so you'll be in the emergency department waiting to see a doctor, and you'll be disappointed only for the doctor to tell you to please go home, that there's no treatment for the diarrhea that is suspected to settle. This is the case in some bacterial infections, but there are times that you actually do need a course of antibiotics, to kill the bacteria, because the bacteria just simply will not go on its own. So that's the difference between a viral and a bacterial infection. While viral infection in 90% of cases are self-limiting, they can go on for more than 7 to 10 days. Bacterial infections, tend to go on for as long as 2 weeks or more and usually need a course of antibiotics to treat the infection.